The Health and Social Services advisor to the Presidency and former Health Minister Dr. Bernard Haufiku said that it is vital that Namibians follow the necessary precautions to avoid any possible extension of the lockdown period.
You see, the whole idea of locking down is to prevent the spread of the virus, but also to see and making it easy, if we link community to healthcare services, that we can easily pick up who are the symptomatic that we need to test and treat and maybe even isolate. And one of the reasons why we make it 21 days is to make sure that we go beyond the 14 incubation period of the virus, that we create an additional buffer to make sure that if you miss it in the 14 days, you actually go up to 21 days. After that, there's no need to test, except if you are symptomatic. Because the virus will not end in 21 days or the next 3 months. It will be with us, and it probably will come a little bit later, towards the end of April, going into May, June. That's where we foresee. Meaning that this lockdown may last a bit longer than the 21 days.
Haufiku added that to avoid a situation like the one happening in China and Italy, we should act early rather than later.
I am confident that if we put these lockdown measures in effectively and early, we will not have too many people dying. Now let's go to that scenario, that unwanted scenario of, we have to die. We need to speak to the responsible sector for cremation, but we know in Namibian culture largely, they don't like their body being burned. So there will be mass funeral, maybe 2 people burying a body and 1 or so, because we will not allow more than 10 people going to funeral. And we need to sensitize the community now, because when they are grieving, they will never listen to us. So that's one thing. I don't foresee mass cremations. I foresee mass funeral, because our people like visiting their bodies where they are buried in, and they don't like burning at all, especially the northern tribes or folks,
Haufiku added that they are in the process of setting up a facility to act as the central hub of factual information during this time of crisis.